This is a case of displaced comminuted intertrochanteric fracture in a 85 years old lady. After giving anesthesia over the fracture table, close reduction of the fracture done by giving traction, external rotation and abduction. In anteroposterior view, reduction looks good, but in lateral view, there are two displacements. One is posterior sagging of the distal fragment at fracture site, and another is external rotation displacement of the proximal fragment. That posterior sagging is due to upward lifting of the distal end of femur by adductors. This posterior sagging can be corrected by anterior lifting of the femur at the fracture site. Here is the bony spike. This is the externally rotated neck of femur. External rotators are attached to the proximal fragment, which rotates the proximal fragment externally. Correction of external rotation is more tricky. Here we have used two techniques. One is passing K-wire along the displaced proximal fragment and then internally rotating using it as a lever. This was partially successful as the bone was osteoporotic and there may be psoas obstruction. Second, using a blunt instrument such as 6.5 mm screwdriver introduced in an anteroposterior direction to anterior aspect to press down upon the anteromedial aspect of the externally rotated proximal neck fragment. Fracture is temporarily fixed with K-wire and we kept the screwdriver in situ till we finish nailing and proximal screw fixation. As there is chances of K-wire loosening in osteoporotic bone during the procedure. We were able to achieve reduction by combining both of these techniques. May be useful in intraoperative management of comminuted intertrochanteric fracture. These are the final images, both anteroposterior and lateral view in SIAM and postoperative X-ray. Thank you.